You're listening to Season 2 of Everyday Epidemics, Partners in Prevention. I'm Mitchell Kilkenny, and this is Sidnee Hedrick, and together we have over a decade of public health and prevention experience. In this episode, we are going to cover the Strategic Prevention Framework, learn more about what it is, what it isn't, and maybe what are some things that you should know about. Last month, Sidnee and I talked about the Strategic Prevention Framework, but today is much more of a deep dive. So strap in, stay tuned, because we're jumping into it right now. What were you up to this weekend?
Guthrie, my son, we took him to the river for the very first time. He loved it. As you know, you were there.
Yeah.
It was so much fun. He has a blast when it comes to water and just like experiencing the new textures and all of that. So that was of course one of my favorite parts about living in the Pacific Northwest and all of the outdoor opportunities we get here.
Yeah, it's wonderful. We have all these great rivers, and especially this summer when it's so nice out, it's hard. We have to go outside and do something. So it was a lot of fun. We also got to see. You entered him into a race.
Oh my gosh. Okay. So this whole thing about having baby crawling races, I was like, oh, first child, let's do it. It's going to be so fun. I honestly feel like I scarred this child. I feel so bad. He did not like it at all. Just an overwhelming experience. Great for those kids that were actually crawling and doing the thing and entertaining the parents. For me, I had a very hard time because Guthrie was not enjoying it. So I was like, okay, we're done. Let's get out of here. And then that's when we went to the river. Everything was made up for that.
Then he was like, yeah, it's great. Well, speaking about crawling and walking, today we're talking about prevention.
Yep.
And I think there's quite a few things that we should, I don't know, do you have experiences going through prevention with crawling to walking? Did they start getting into new things? Are you worried about it?
Oh, well, the biggest thing is baby proofing the house, right? And thinking about all of the safety precautions you have to go through that you wouldn't normally think about. And it's funny, too, because, they recommend, get down on their level. You crawl around the house, too, and see, what are you going to bump your head into? What are you going to reach and grab and possibly put in your mouth? Because that's what they're doing.
Yeah.
And so, yeah, that whole aspect of, just trying to keep them safe in the home is a big one, And then there's others, too, like the sunscreen. You have to be very careful with baby's skin and protecting them. So yeah, lots of ways this interplays with starting to become a parent, and then it's only going to become more and more as he gets older, new things to be aware of. And a lot of it, ties back to, again, the behaviors that they might experience, experimentation with substances,
right,
and how that was going to directly play into, our work. So I'm feeling like maybe I have some more information about that when he gets to that age.
So even on our last episode, we talked about what prevention is. We talked about some of the risk and protective factors. Mm-hmm. And then we briefly mentioned that strategic prevention framework as a roadmap for this effective prevention.
We're going to get into that.
Yeah.
I'm hoping that really highlight prevention and that it's not just random, right? We're not out here just doing a campaign here or a class there. We are strategically implementing programs and practices that will have the intended or desired effect based on research, based on the capacity that we have in the community, based on the readiness of the community. And a lot of these components come from this framework, the strategic prevention framework that help guide us through. Today, we're going to get to talk through those 5 steps, bring to light how prevention works, how we need community partners and community buy-in to have the impact that we want in our community.
Remind me, this was a model developed by who?
SAMHSA.
Oh, okay.
Substance Abuse Mental Health Services Administration. Mm-hmm. And so, yeah, that's a mouthful.
That is
right?
a lot. Yeah. SAMHSA. Okay, much easier to remember.
But SAMHSA, it's been used for years in the prevention field. It's been proven to work.
Yeah.
And that's why it's often used by prevention professionals.
And I think a lot of people probably use it and maybe just don't know that they're using it, or use some sort of version of that.
Or use parts of it, but not necessarily know that there are pieces you can tie together, you can make it more intentional, and you can directly, tie in the data pieces with your intended outcomes and link those together in a logic model, which we can talk about as well soon in the planning phase. Like you said, maybe we're already doing parts of that. Part of this podcast is, okay, what gaps maybe are we missing? How can we fill those to really capitalize on the work that we're doing?
And so there's 5 pieces of this prevention framework, right?
Yep.
It's assessment,
Capacity, planning, implementation, and evaluation.
Okay.
And then it's guided by these 2 core principles: cultural competence and sustainability. So those we can kind of talk about, we'll intertwine those into each step as we go through the process. Step 1, assessment. So what is that? First of all, it's really all about trying to figure out like what are the problems in the community. So there's different factors that you have to kind of consider when it comes to what problem you're going to address.
Yeah, and what's his highest priority?
Yeah, exactly. In order to even know what those problems are, like the assessment piece is finding the data to support it, whether it's qualitative data, quantitative data.
Or a mix of both.
Exactly.
Yeah.
Hopefully a combination of both. So that can look like, getting actual verbal feedback from students on what they're seeing, what they're experiencing. That's some of the qualitative data. We also utilize youth surveys. The state Oregon Health Authority does the student health survey. And so we can look and see numbers based on what students are responding, saying that they are vaping or they're not vaping. And we can see what percentage are saying that.
Yeah.
So that helps us know where we're at with student vaping. So those are a couple examples of like how assessment helps drive understanding the problem in our community.
Some of the data sources that you talked about, student health survey, we use that here. But one of the other things that you can think about in terms of tobacco is tobacco sales data. So we have to, these are legal products, they pay taxes on them. We can look at how often these products are getting sold. And what's interesting about that is sometimes like new products like Zyn, just new nicotine pouch product, what we can look at is we can say, well, what are the sales of this product? And it turns out that the sales are very, very high. And then we correlate that with survey data saying who is buying these products. And most people over the age of 25 are not buying these products. So then that leads us to a good correlation of like, well, who's going to buy these products? Well, it's probably not people over 25, probably much younger.
Yeah.
And then we go to schools and we do anecdotal evidence, which is we ask a whole classroom, hey, how often are you seeing these products on a scale of like 1 to 10? And most students are saying a 7 or an 8.
Yeah.
So again, we take all of these data sources, pull them together, and we go, is this a problem here? Is this a problem locally, nationally, in Douglas County? Yeah, it is a problem. It's a big problem. And in fact, more students are buying these products than any other adult or person in our community.
Something that we have to do in the assessment piece is, okay, we know that vaping is the problem we want to address, but what exactly are the risk factors that are relevant to our community? Because when it comes to the planning phase and identifying strategies, we have to make sure we're matching the strategy with the risk factor or the protective factor that we're after. So if you think about our community, I can think of a couple risk factors, and I'm sure you can think of some more. Students possibly using vapes to cope. They're reporting that it's a coping mechanism and makes them feel better, as an escape route, right? Sometimes it's a social thing where their peers are offering it to them and they want to, be part of the in crowd. And so factors like that. Others are like if vaping happens in the home and it's just kind of a regular thing that they're doing. Or if they don't understand the harms of vaping, then they're more likely to use. So these are all possible risk factors, and then you have to identify, which ones are most prevalent in your community to know what's the best strategy.
You hit a lot of the good ones. I mean, and we can kind of generalize that into a couple of things, which is education. How educated are they about these products and the risks of these products? And then the second piece is ease of access. How easy are they to get a hold of? Are they in your parents' household? Are you getting them from friends? Can you just go to the downtown street market and buy them?
Right. And knowing like exactly where the access is coming from too, because if it's coming from the market versus parents, that's a different strategy. Yeah. Addressing each one. Yeah.
And I think it's important to note too that as we do this, as we go through this assessment, there's multiple pieces to this puzzle. It's not just one solution. It's not like, oh, all these stores are selling tobacco. If we crack down, it's going to fix the problem.
Yep.
That doesn't, stores might make up, I'm making up a number here, maybe 10 or 20% of how students get these products. And if that was true, if it was 10 or 20%, we could work on a solution towards that, but we're still missing 80% of the puzzle.
Right.
So a lot of our work, we do an assessment in that planning phase, which we'll get to. We need to figure out what types of solutions, and probably several of them we need to implement all at one time.
Exactly.
Okay, so we've talked about assessment, and we provided some examples and talked about a little bit of risk and protective factors. But what about capacity?
Capacity is all about okay, we've identified the problem. What resources do we have, and do we need gaps to fill to actually do something about the problem? So a lot of this looks at partners. And I cannot stress this enough when it comes to prevention. Lots of times we identify, okay, vaping is a problem. And if I myself, as the prevention program manager at ADAPT, identified this problem and wanted to find a solution within our program, it would be so hard to do it alone.
Yeah.
We don't have the capacity. We don't have the fiscal resources ourselves, and we need the partnerships to make it happen. We don't have direct reach to students, if that's who we're trying to reach. And so when you think about how you actually put the pieces together and how you get those partnerships, it's really reliant on you making sure you're doing your due diligence and checking with the community who's already doing this work. Right. How can we partner together? How can we put our efforts together so that we can actually have the impact we want? In order to actually do something about it, do the people have the capacity within their own selves? Do we have to find other partners to bring in?
Yeah.
Do we have relationships with schools, right? And that's a big one. And you can maybe talk about how, in order to reach the schools, we actually went and talked to the superintendents about the vaping problem and what we were hoping to do about it.
Absolutely. So it's really difficult to get in schools, which maybe is a good thing, right? Not everybody can just go to schools and present or, provide what they think is best. And so trying to reach schools to get our education, our information with them was difficult. And so we had a process or a plan to say, let's go talk to the school leaders, the school superintendents. And we did that. It took a while, but we made it happen, and we went and presented to them. And what was great about that meeting is a lot of them didn't know about a lot of these things. They didn't understand how prevalent vapes were in schools. They knew it was an issue, right? They knew it was there, but they didn't quite fully understand it. And they were very receptive to, we would love help. We would love to, be supported and work together to collaborate in this issue. So that was one piece of what it took to help build that capacity towards better relationships, to work with schools, to do more catch my breath classes, and even really more of these school health fairs that we've been putting on.
So I would say advice as far as trying to build capacity and with the schools, for example, is not just pushing your agenda on them, but trying to show them that we have the same goals, and this is why addressing the vaping problem is going to be beneficial for your school.
Yeah.
It's not just that less kids are going to be vaping, but what are the other consequences of vaping, right? Maybe attendance rates will go back up. Maybe we'll have better focus in the classroom, higher grades, all of these positive impacts that the schools want and need for funding, right?
Yeah.
Bringing it back to how can we help each other? We have the same end goal. We want to align our efforts in order to get there. So when it comes to step 3, I think that's a good jump to the next step in the strategic prevention framework. With planning, we're trying to now match our risk and protective factors with the actual strategy that we're going to use. For vaping, if we've identified that there's a lack of education about vapes, there's some social aspect about peer use, we actually go and then look at evidence-based programs that are already out there. There's been research done on them that shows if you do this program with your kids, they're going to have more knowledge, more awareness of vaping. They're going to have better peer refusal skills.
Yeah.
They're going to be more aware of the marketing tactics that are targeting them. And that's what we do as professionals. We identify those available resources already out there. Yeah. And that's how we did come across the Catch My Breath program. Again, specifically intended to increase that awareness, increase peer refusal, and all of those risk factors that we were trying to address.
So in this planning phase, you're looking for these evidence-based programs that we can use and implement into various places like schools,
Right.
that we know will make an impact.
Yeah.
Because what's the alternative? You come up with these plans on your own, you try them out, you run some evaluations, and you're like, maybe it works, maybe it doesn't work.
Right. Yeah. It's nice to use ones that have research-backed results if you can.
Yeah.
Now, there's not always that opportunity.
Yeah.
But if there is something available, that's ideal. The other reason planning is important, as you're mentioning, is because we don't want to just like jump into something without knowing exactly the problem or the risk factor. So let's say, these risk factors are present. It's, peer pressure or the education, but maybe the actual biggest one is parental use and them getting vapes for their child, and that's allowing easy access to vaping.
Yeah.
A Catch My Breath program at the school is not going to address those risk factors, right?
Right.
So it doesn't ever reach the parents, really. There's maybe one or two take-home things that's saying, hey, we're doing this education, but it's nothing more than that.
Right.
It's not addressing the access to vaping, really. If you're trying to do an evaluation on reducing access from parents through using a Catch My Breath program, you're not likely to be doing that with that practice. So that's where creating this sort of logic model, linking the problem behavior with your risk and protective factor, and then the related evidence-based practice, hopefully, to address those.
So what you're doing is you're saying, here's all of the pieces of the puzzle, and here's how they all link up. That's your link tree there. Yep. And then you're picking, this is how this is going to do this is how this is going to affect this is how I can do this protective factor. And so you're building programs or policies or implementing these different solutions to target each piece, so you're putting them all in the right places. Right.
And hopefully, as we mentioned before, doing multiple at once.
Again, one of those pieces of the puzzles is something called the TRL, which is short for Tobacco Retail License. And it's a program that the state holds. So the OHA, Oregon Health Authority, holds this program. And the idea is to reduce sales to kids. Convenience stores aren't selling tobacco products to folks who are underage. In addition to that, they also need to follow certain compliance standards. So one example of that is you can't have products that are easily available. Like, couldn't have a vape device that's colorful and flavorful right on the front shelf where any kid could just grab it.
Yeah, typically like right at the checkout line where the candy bars are.
Right.
You're trying to put vapes there.
A candy bar here and then a vape here.
That's a no.
Right. And stores would do that. And so that's why these laws were put in place. The TRL is a program that enforces those rules to make sure that those convenience stores and all of the stores, who sell tobacco products are not selling to minors and also are adhering to those compliance standards.
Trying to hit multiple risk factors is going to have a greater impact community-wide.
Absolutely. And I think that kind of leads us into implementation of like, we do all this, now we have to implement it. We've realized it's probably going to work.
Yeah.
What's next?
Yeah. And I think with the implementation piece, the step is exactly as it is. It's just, okay, we've identified what strategy we're going to do, Catch My Breath in this case. Now we're going to go in the school and actually do it. A lot of the talk about implementation is balancing fidelity with adaptability. So fidelity comes to like, are you running the program as intended based on what the research shows to actually make it evidence-based? So for example, the Catch My Breath program, it is a series of 4 lessons across 4 weeks, structured that way to allow some space for the information to digest, to have a week off to kind of recap and relearn. We know that there's science behind this learning process this way, giving it time to digest. But sometimes when we go into a school and they say, yes, we want to do the Catch My Breath, but I don't think we have like 4 weeks to do it. Can we condense it down into 2 weeks, or can we do like back-to-back days? Like, can we knock it out in a week? And we work with them, right? We say, we can do that, but the best practice would be to actually do 1 lesson per week for 4 weeks. Is there a way we can do that?
Yeah.
Or at least get as close to that as possible. That's what we talk about when it comes to kind of the fidelity piece, keeping the structure as intended, keeping the core concepts as they were written. Lots of times we talk about it as like, okay, if you were making a chocolate chip cookie, you wouldn't skip the flour piece, right? That's a core component to make the cookie. But what you can do is add 2 core components. So maybe I choose to add a little bit more chocolate chips to my cookie. That's not going to ruin the cookie. That might actually make it better, depending on who you are. It goes back to that, keeping the core components and trying to keep to fidelity as much as possible. Adaptability has to happen because no community is the same, and just kind of being ready when unexpected things happen. For example, maybe the day you're supposed to go into a classroom, it's a snow day.
Yeah.
Okay, so how do you make that up? That actually happened to us once. Or maybe the facilitator for that classroom is sick that day. And how do you figure out how to either someone else can jump in and cover the class, or do you reschedule it for another day? So those things come up with implementation, and there can be struggles. And lots of times think, we get to implementation, we're smooth sailing, we did all the planning.
Right.
There's definitely challenges that can come up. And another thing too I want to mention is, have you ever had a teacher where they really truly made a difference in your learning experience based on just how they were enthusiastic and cared about the material? And it could have been like the most boring subject. Yeah. But because the teacher was engaging and made it fun, you were present in the moment and actually took something away. That's what we're trying to do with the Catch My Breath program, because we understand that like students in the classrooms, someone's coming in and they're going to talk to us about don't use a vape. Yeah. Well, that's not the most exciting thing to be coming to school about, right? Yeah. So we have to figure out how to make it engaging and something that they're going to remember. So when it comes to identifying like our facilitators and that capacity step, we really do try to find people who are passionate about this and passionate about caring for kids and working with kids and knowing how to communicate with them so that it's engaging and a really truly learning experience.
Absolutely. I think one thing I've found very helpful too is just storytelling.
Yeah.
How well can you tell a story and bring them through this? Shout out to my high school math teacher, Mr. Richards, who was excellent. He was great at math, and I learned calculus because of him. Thank you very much.
That's so funny because I wanted to shout out Mrs. Rainmaker, my science teacher. She really led me down that path. Like, not a lot of people necessarily are enticed by science, but when you have that teacher that really cares about what they do and they get excited about it, that makes you excited about it. Yeah. But really, that last step evaluation, it's critical, right? It's did we do what we wanted to do piece. Yeah. And it helps you modify and adjust as you go, make your program more successful as you continue. If we relate that back to the vaping among youth and the Catch My Breath program, we make sure we have a pre and a post survey to get students' responses on what did they learn during the 4-week program, and are they feeling like they might still want to vape after the class. And all of that helps us know if our implementation was solid, if the program itself was a good choice. Maybe it wasn't a good choice to choose Catch My Breath, and we will know that based on the evaluation. Or maybe it's hitting some of the pieces that we wanted but not others. And do we need to complement it with other aspects or other strategies? That evaluation piece is big. And then also going back to, we recognize this, but we also have to convey this to our partners, is that true prevention is a long-term process. And so while we might be able to measure like initial increased knowledge or increased skills based on a 4-week program, we're not going to be able to measure like a reduced rate of vaping right away. Right. That's a multi-year process. And so tracking those larger surveys that the state does, the student health survey, and hopefully we can see trends go down over time. That's a big one, I think, when we're talking with partners and especially schools, because they see a need, like vaping's a problem. How do we make it stop now? Yeah. There are ways to help those individuals who are vaping in a different way. But if you want long-term impact, we have to go the prevention route. And unfortunately, you just don't see results for a few years from that.
It's a really big key point to take home, is that prevention doesn't work overnight. It's not an overnight process. It takes months and years upon years. Probably remember a time, in the 40s, 50s, and 60s when cigarettes were very prevalent. And at one point in time, it was like half of high schoolers are using them. I mean, it was very, very high. Yeah. And then over time, we plug in prevention, we do PSA ads, we do campaigns. I mean, this is all public health work done over decades of time. And what we see today from the results of that are that less than 3% of youth in Oregon use cigarettes.
Yeah, it's a great win.
Right. But it didn't happen
But
overnight. It took a lot of time.
And a lot of angles. The
yeah.
campaigns was one angle. The policy work and raising the legal age is an angle. The education is an angle. And it's also a piece to, as years go by, you learn more about the impact of a substance.
Right.
And this was big with cigarettes, right?
Yeah.
In the beginning, there was nothing about the harmful effects.
Right.
But as years went by, more research was done, we learned those.
Mm-hmm.
And I think that's been one of the struggles with the vaping problem and addressing that is we really only know short-term impacts of vaping. We're just now starting to learn some long-term impacts because now it's been around for a little bit longer.
Yeah.
And sometimes it takes those long-term impacts to know those before you can really convince the community that this is a problem.
Yeah. Hitting all of the factors, all of those pieces in the puzzle, and doing that for a long period of time to really address these bigger issues.
So that brings us to our two core components actually of the strategic prevention framework, one of them being sustainability. Over a long period of time, how do we have impact for years and years? And so having a Catch My Breath program for 1 year for one class of students, that's not going to have long-term impact on our community.
Right.
That might help that one class and those students. If we're looking for a statistical change in vaping among our youth, we need to continue that program for years and years, and we need more and more classrooms to buy into it.
Yeah.
One of the reasons that sustainability is a core component of that strategic prevention framework, and it ties into every step. And then secondary to the sustainability as a core component is cultural competence. So making sure that the programs that we implement are reflective of those that are most in need, address linguistic needs, cultural practices might be going on in communities. These are all things that should be incorporated into the planning process when it comes to the framework. An example of that for the Catch My Breath would be when we send education home to parents, we make sure that there's Spanish versions as well, because we know that we have Spanish-speaking families in our communities. When it comes to the assessment, we make sure we get youth voice telling us what they see, because they're our population of interest. Including all of that in each step of the strategic prevention framework is super important to make sure we reflect our community and the community's values.
Yeah. If we had to wrap up everything in sort of a call to action, because who doesn't love a good call to action? If you're an organization out there or a person listening to this podcast, we hope that you see prevention maybe a little bit differently than you might have otherwise thought. And we hope that you share this episode with someone in your network or a community partner. And also, make sure you subscribe and stay tuned for our next conversation, because we're going to take a deep dive into the specific parts of each framework. And we're also going to bring on some guest speakers whose job is solely to focus on that part of the framework. We also want to invite our listeners today to take a survey, which is down in the description. I believe we're going to raffle off a Dutch Bros gift card as well. So go ahead and fill that out down below. And thank you for tuning in and joining us. We'll be happy to answer any of your questions if you leave them down in the comments, and perhaps we'll do a whole episode just on your questions.
Yeah, I think that would be great. Awesome.
Well, thanks everyone for tuning in today, and we'll see you on episode 3.
Bye.